Sure. So you apparently have some talented people.
Yes, much talented than me.
Chairman Matherly, can you hear me? This is Robbie.
Yes, I can hear you, Robbie.
Good evening, sir.
Good evening. How are you?
I'm good. How are you?
I'm good.
Greg, I agreed with you on that statement.
I know you would, Commissioner Lott.
I know you will.
I know you do.
Hey, Greg, can you hear me? It's Brian Davenport.
I can hear you well, Commissioner Davenport.
Thank you.
Susan, it is 6 o'clock, I see. So do we have everybody on or what do we look like?
We do not have Commissioner Harris and Commissioner Williams. Are you with us?
Yes, I'm with you.
Thank you.
Can you hear me?
Yes, ma'am.
All right, good.
All right. We'll go ahead and open our meeting up of the Washington County Board of County Commissioners here on April 22nd at 6 o'clock. I guess our first order of business is our prayer. Commissioner Carriger, could I call on you this evening to ask
Yes,
our
sir.
prayer?
Yes, sir. Be glad to, Mr. Chairman. Let us bow our heads. Let us praise the Lord who forgives all our sins, heals all our diseases, redeems our life, gives us crowns in heaven, who loves us and shows compassion toward us, who satisfies our desires with good things. Let us remember the Lord is compassionate, gracious, slow to anger, and abounding in love. Amen.
Amen.
Amen. I just want everybody to know that was an awesome prayer, Commissioner, and you have no advance notice.
Thank you, Mr. Chairman. Sometimes I do better than other times.
I do appreciate that prayer this evening. I know we all do. Madam Clerk, if you can call the roll for us, please.
Can you hear me?
I can. Yes, ma'am.
All right. Light.
Present.
Fitzgerald.
Here.
Harris. Eden.
Here.
Davenport.
Here.
Matherly.
Here.
England. Malone.
Here.
Williams.
Here.
Carriger.
Here.
Jones.
Here.
Chester.
Here.
McAllister.
Here.
Wheeler.
Here.
Ford.
Here.
We have 13 present, 2 absent.
All right. Thank you. We do have a quorum present. If anyone else joins us, Susan, would you let us know so we can know they're on?
Most certainly.
Thank you so much. Okay, our next item is we'll go to Allison and our determination of essential function of the governing body requiring this meeting. Allison, is there anything you need to remind us of or cover with us before we vote on this agenda?
I would just remind you that the agenda is COVID-19 specific with the mayor's update as the chief local elected official. And he may have some individuals that he's called on for your update this evening. And you've also got the director of health. And then you have course, any administrative issues that you'd like to consider, and all of that is COVID-19 related. So when you're making that vote, I think you can feel secure that it is the central governing function of Washington County.
Thank you so much, Allison. Do we have a motion to approve this essential agenda?
So moved. Second.
Who made the motion?
Danny.
Thank you, Commissioner Edens. And seconded by Commissioner
Carrigan.
Carrigan.
Yes.
Okay. All right. Is there any discussion or questions about the motion? Seeing none, Madam Clerk, if you'll call the roll, please.
Light,
Yes.
Fitzgerald,
Yes.
Edens,
Yes.
Davenport,
Yes. Yes.
Matherly,
Yes.
Malone,
Yes.
Williams,
Yes.
Carriger,
Yes.
Jones,
Yes.
Tester,
Yes.
McAllister,
Yes.
Wheeler,
Yes.
Ford. That's 13 yes, 2 absent.
All right, the motion passes. Thank you, Madam Clerk. All right, our next item is our status update on the COVID-19. Mayor Grandy will go to you, and you can bring us the update.
Thank you, Mr. Chairman, and welcome back for our Wednesday meeting. So, as I indicated last Wednesday night, felt like from the governor's comments on Wednesday afternoon last week that he probably would not extend the stay-at-home order that he had put out. So that was confirmed on Monday, and so we anticipate businesses to begin to reopen soon. Not waiting for the announcement on Monday, we started Thursday, working with our neighbors in Johnson City and across the county lines to begin to think about a strategy in phases to reopen business as quickly as possible. I mean, that is one of the highest priorities, but doing it in a responsible way that would not put us back to the beginning of this thing in terms of a health situation. So we're working with our health community who have been phenomenal all the way along, giving advice and so forth. So we have elected leaders and city managers from across the region Zooming together periodically. I think tomorrow sometime we're gathering together with the health officials to get their advice as we begin to stage businesses opening. We're anticipating on probably Friday now is what I'm hearing, that the governor will provide some sort of directive as to what businesses will be allowed to open, and maybe even how some of them will be able to open, and do that safely and prevent a surge of the virus going forward. So I have created a task force, business economic recovery task force, that is meeting to work on specific opportunities for business and so forth. So I'm just gonna leave it at that for now, because there are a lot of things going on. There are a lot of plans being developed. Certainly, anyone who has any ideas or suggestions, we would appreciate the input. Nobody that I've found so far has all the answers. Tonight we have a guest, Eric Deaton from Ballad Health, who I've heard from in the past. And Eric, thank you for being here. And I'm going to let you just go first, because I'd say Alan's probably got you doing a lot of things and wants you back. So if you would give us some Ballad Health perspective, I would appreciate that. Thank you.
Absolutely, Mayor. Thank you. Thanks, everyone, for having me tonight. My name is Eric Deaton. I'm the Chief Operating Officer for Ballad Health, and we have stood up a corporate emergency command center here that's been in operation for 45 days now. And that focus is really for us to look at policies, look at operationally how do we attack and help support how we attack COVID-19 and how we support our community in the treatment and of that. So a lot of things go on in that center, particularly around making sure we have supplies available, that we have the right staffing available, that we have beds available for COVID-19. We, just so you know, we have designated a little over 325 beds available for COVID-19 across the region. And we can actually go up to 385 beds if we need to do that at some point. That would be with the activation of turning what was Tacoma Hospital into a COVID hospital. We have about 245 ventilators at our disposal. As of today, about 50 of those are in use for other patients and some for COVID patients. Over the last 7 days, just what we track, not what is tracked through other agencies, but what we track from a positive standpoint of COVID patients, we've seen less than 10 per day, and the last few days have been 4 or 5 per day. So there does appear, from our perspective, to be somewhat of a leveling off there of the number of positive. But Dr. Kursky can update you on the region. And let me just say, it's been fantastic working with Dr. Kursky and his team, and Dr. May and his team with Sullivan County also. Everyone's worked very hard together. We've communicated very well. We really appreciate their support that they give us, and we have a great working relationship there. A couple of things I'll mention. You may have seen in the paper recently. We're working on a plasma Mayo's Clinic research study where we take plasma from a patient that's been COVID positive, and we provide that plasma to a active COVID patient. I think we've done that probably half a dozen times in the last few days. I don't know results today, but I can get back to you on how that's going. But hopefully that will be very promising to help those patients. Today we have in-house, we have 16 confirmed cases across our system that are COVID positive, and we have another 14 that are under investigation. So we have 30 possible COVID patients being treated inside the hospital today. And we track that on a daily basis. We are doing contact tracing when we have a positive to help us understand how spread that is and to notify other people that they may have been in contact with COVID-19. One thing I'll mention also is that we, as you know, the governor has set up an economic recovery group, and one of those groups is a healthcare group. I sit on that group to represent hospitals, and we have had a meeting yesterday and today to talk about the reopening of the economy and of businesses. And our particular focus has been around really looking at starting to do non-emergent procedures and surgeries again. So we have pretty much completed most of our recommendations. We'll be providing that to the governor's office by tomorrow morning. And I think, as the mayor may have said, I think the plan is for all these committees. There's some 12 committees that are working in different parts of the economy that will be providing recommendations. I think the governor, from what I understand, may be providing guidance more of how we open the economy by Friday. One way I've heard it mentioned is this would be more, if you relate it to a light switch, it's more like a dimmer switch than it is just flipping a switch on, and it needs to be done in a careful manner. We're still advocating for social distancing and being aware of large groups and how we go about that. But I will say I've been very proud of the people in East Tennessee, how well they have done with social distancing. I know it's been really, really hard, but I'm very proud of the work that we have all done. And so I think at this point, from a perspective of supplies and personal protection equipment, PPE, we feel good about that we can start doing surgeries again. We have adequate supplies to do that. We have not seen the spike in in-house patients that we were modeling early on. So we feel like we can start opening up, start doing surgeries relatively soon. Regarding that, we have a number of our surgeons and physicians and other leaders that are working on how we go about doing that. And we do want to make sure we do it in a responsible way, so that when we do start doing surgeries again, that we don't use up a lot of our PPE inappropriately. And so we're being very careful on how we do that. There's a lot of small businesses out there that are physician offices, for example, who need to get back to work and are really suffering because of that. And there's a lot of patients out there who need to have surgery done. And so we're looking forward to being able to accommodate those patients and to support our community moving forward. So, like I said, we are working on those recommendations internally and for the state, and hopefully when the governor allows us to start working again on those cases, we can open that back up and start moving forward. Mr. Mayor, I'll stop right there to see if anyone has any questions for me right now.
Eric, do you see valid being part of this antigen testing study to see, if we have people out there that are immune?
Yeah, the antibody testing, we think that we'll have availability of that by next week, and we have two sources that we're looking at. You've heard about the Abbott source. That's one that we think that we can have access to, and then the other one would be Beckman. They're two different lab companies. Probably the difference in what you've seen on TV and what we'll do is ours is not a finger prick type, but it would be an actual blood draw, and we would use our chemistry analyzers to do that. So we can tell we'll be able to tell if you have had COVID-19 and carry that antibody. So we'll probably talk more about that as we start to bring that up, but we think we'll have that availability next week.
Any other questions?
Let me mention one other thing about testing, and that's we have been able to boost our rapid testing, our in-house testing we could probably do 300 to 400 per day now on rapid testing. And I think part of our plan would be, as we start bringing up surgeries, we would want to test patients prior to surgery for a couple of reasons. One, so the patient knows, and secondly, to make sure that we're using PPE appropriately and that our team members are being responsible and safe and they're caring for those patients.
Eric, thank you for your time tonight, and appreciate all the great work the Ballot's done, and to be able to create 300 bed capacity for potential surge is amazing. So thank you.
Well, again, it's been a team effort. We appreciate it, and we certainly appreciate your all support of us. And so please let us know if there's anything we can do. Any questions we can answer for any of the citizens of our county. We're happy to do so.
Great, thanks.
Thank you.
So Dr. Kursky has been in Johnson County today, we understand, doing some testing, and he and Kristen are here with the health department. So any news from y'all's front?
So just an update from our testing over the weekend at ETSU. We tested a lot of asymptomatic people, which the return for investment on that's pretty low. As far as I know, we haven't had any positives return yet from that. But like I said, it was mostly asymptomatic people, which we did not expect them to be positive. So I don't think all the results are back yet. So we'll hear in the next couple of days exactly what happened with that. So I guess, we don't have any details on how the reopening is going to occur or what the phases are or anything like that. But we do expect, if any relaxing of social distancing is going to increase the number of cases and deaths that we're going to see in the region. So we do expect there to be an increase in cases, and along with that, increase in hospitalization, increase in deaths. So, we're really at the same point we were when we closed things down in terms of the number of cases in the community. So if we relax social distancing at this point, really, I think the only trajectory is going to be an increase in cases. So everything's going to be more dangerous, going to the grocery store and things like that. So we will have to continue everyone's going to have to practice prevention, social distancing. It's not just going to go back to normal when we do reopen. So I guess, we're somehow going to have to make sure people understand that as more services open back up, that it's, there's going to be cases in the community, and there's still a chance for, a surge in cases, even potentially an overwhelming surge. So we have to also be ready to shut things back down if that becomes necessary, like if hospitals reach capacity or things like that. So I don't think it's going to be like a simple, everything goes back to normal. So we are, everyone in public health is very concerned about how it's going to be after, and we haven't seen any details of what the governor's going to say, but everybody in our community pretty much is still susceptible, and the virus is still out there. So we'll still have to continue to protect our older people and also our people with pre-existing conditions. So even if younger people are not that concerned, and once things open up, if they abandon social distancing and it spreads among younger people, we know that each person that gets infected infects 3.5 other people on average, sometimes more than that. So depending on who they infect, if it's older people or people with pre-existing conditions, there's going to be bad outcomes from that. So I think we just need to make sure our residents understand, going to the grocery store, they still have to be very careful, maybe even more careful than they are now, and to all the other services. So I think I guess it's really in how this thing rolls out is going to affect the trajectory of how many more cases we get. I guess the other thing we don't know is whether the spring and summer weather is going to help us out at all, or already has been helping us. So it's unclear what effect all that has. But I think most people also think that if that does occur, that we're going to get another wave in the fall if we don't get a big surge right now as we start to reopen. So I don't think we're out of the woods by any means. I think we're just like getting into the woods. So we'll continue to have to talk and figure out how we do this in the safest way possible. But I think no matter how we do it, there's going to be an increase in cases as we reopen more businesses.
And we're still doing our daily testing at the local health department as well. Monday, we were kind of surprised. We had 96 people come through our testing site. Yesterday, we did 88, and today we did 61. So not really seeing a lot of symptomatic people coming through for that drive-through testing with the National Guard. But, as we continue to get those results back, that will give us some more data to see a better picture of where we're at with those infectious cases, if we have any of those or not. We still appreciate that support from the National Guard. I don't think we could have made it Monday without their help. So just was kind of surprised at that outcome. Some of those people had been in line to be tested at the events over the weekend. Those testing sites had to close down, and so they were redirected to their local health department. So that's where some of those on Monday came from, and as we've seen throughout this continuation of this week. So we're continuing to test Monday through Friday from 9 to 3. And at this point, anybody is eligible to be tested, whether you have symptoms or not.
Yeah, we are still encouraging people with symptoms to get tested, and it's unclear whether testing asymptomatic people helps us really at all. But basically, we will test them if they want to get tested. But the people we need to test and want to test are anyone with symptoms of coronavirus, including atypical symptoms or mild symptoms. But the best strategy at this point is to test people with symptoms. is the best use of our resources. But we will test anyone that insists on getting tested.
And I'll just add that we can send you doing testing as well and using our Nurse Connect to screen people, and totally agree. We need to be testing people that are symptomatic. And so we continue going through a screening process and doing that as well.
Jody.
Yeah, a couple of questions. The first one is, what is our staffing capacity in public health? If we get to a point where we can test really routinely and we start identifying more people because, you know, we're out and about more, do we have enough public health officials to do contact tracing and locate all of the folks that have been in contact with positive testing individuals, inform them, kind of help them get into quarantine and, you know, offer testing to them, et cetera, like that whole gamut of services people need once they've been in contact with someone who tests positive?
Yeah, so currently we have capacity and we also have surge capacity, and then also on top of that, like a backup plan of volunteers to use. But currently we have public health people that are either working from home or have been, you know, that are basically at home. So we have people we can call in.
Great.
And then after that, we have Medical Reserve Corps that we can utilize as well. And then also in Nashville, there's also other volunteers that can help us with the contacts as well.
Awesome. And if, one of the things I've been really confused about is, you know, I don't know if there are public health guidelines, specific businesses reopening, like for example, hairdressers. I know mine, I talked to her today for quite a while about her experiences, and she had found some CDC guidelines around how to operate her shop. She's not super comfortable with those and wondered about whether there would be state guidelines or local guidelines. And then how does that get enforced? I mean, do public health officials check in on those things the way they do safety standards in restaurants, or how does that work?
Yeah, so we do not regulate hair salons and things like that. That's Department of Commerce. So I've not seen any details from the governor or the CDC on reopening those kind of businesses, but you would definitely be concerned, one, for the person working there, like the hairdresser or the person cutting the hair could get infected by people coming in. So we would definitely want to exclude sick people, but that doesn't exclude someone that's asymptomatic coming in to get their hair cut, who then could give it to that person. And now the hairdresser potentially, you know, people are infectious for a couple of days before they get sick. So she could work for 2 days before she starts getting sick. And then, you know, hopefully she's not seeing elderly patients, but if elderly people or people with pre-existing conditions come in to get their hair cut, potentially could infect them. So it's one of the problems with, you know, it's one thing we worry about with reopening, that things like that are going to occur and be a risk. So we still do recommend that people that are at high risk, even when things start to reopen, they need to be very careful and stay home as much as possible. And if you don't, I mean, it's really, you have to calculate every time you go to the grocery store, the drugstore, go get your hair cut, you know, is it worth possibly getting coronavirus to do this? So, and it's going to be, once we reopen, it's going to be, you know, more so. It's going to be more of a risk.
Thank you so much. I appreciate all you're doing, and see you on TV just about every day. So I only imagine how much you're doing. Thank you.
Other questions for the health group?
Yes, I did. I just want to ask, you made a comment about testing resources. I mean, you have enough? Obviously, you're tested 800 this weekend, and I mean, how's that holding up, or are you getting your resources to test? I know that they've talked about that, not enough tests to go around.
Yeah, so currently we definitely have enough to test people that need to be tested. So, but if we do get into a surge situation where we're having to do contact tracing and things like that, we are trying to encourage the private sector. You know, the hospitals are testing. Many of the larger medical groups are doing their own testing of patients that come in, but we do have other people in the community that aren't doing testing. You whether they just haven't ordered the supplies or they don't have enough personal protective equipment or whatever. So I think going forward, we will need for all of our providers in the community to make sure they have enough protective equipment to do testing, and then also to have the ability to test their patients, because it's going to be important to identify any cases going forward very quickly, so that we can get them into isolation and then find all their contacts and do all that public health things that we do. So, one other thing going forward that's a little bit concerning is we still are getting reports from first responders about trouble getting enough PPE so that they can be safe when they're on the job. And then also nursing homes also not having enough PPE. So we really worry about nursing homes. So opening up could put our people in nursing homes at risk. So we have to be very careful there. And then also our homeless population and jails are some of the congregate settings that we really worry about. So we're just going to have to be extra vigilant. And then, so we currently, like I said, do have ability to test, but we're also going to need the private sector, especially those, primary care providers in the community to be able to test people that come in.
Anything else?
Actually, I have a question for Eric, if I can. Do you guys have I assume that you're worried about a surge in cases as we reopen, and do you have any kind of modeling or prediction of, what we might see? I guess it really depends on the details of how the reopening happens.
Yeah, we've been looking at a couple of different models. We use the Penn State model, and then I think SG2 is another organization. We've looked at the modeling there, and then Vanderbilt actually came out, you probably saw, with a model a couple of weeks ago. And we have been, every model we've looked at so far, we had fewer patients than what the model had projected. So obviously the social distancing, as you mentioned, is so important. And that can actually push our model up. So we could see, if that is stressed where people are not paying attention and doing the right things, then we could see a spike of probably 70, 80 patients, fairly quickly in-house. And so that does concern us, is to see that spike. And so that's why we agree with you that social distancing aspect and not having large groups together is going to be really important as we ease back into opening the economy.
Yeah, I think, yeah. So, and, public health recommendations are still that people will need to continue to wear face masks in public, especially even more so. One thing I think a lot of people don't understand is just the exponential increase in cases, because every person infects, almost 4 other people. So that, very quickly becomes 8 and then 16 and then just, so it's kind of like with the flu season every year, we hear about flu in the community a little bit. And then within a week or two, all of a sudden we're having news reports about the hospitals full and stuff like that. And it just happens, without us really noticing it. But then all of a sudden we're just overwhelmed. So that could very easily happen here where, if there's some undetected cases in the community, in a very rapid fashion, that could become a lot of cases before we even find out about it.
Yeah, and that's obviously why we have stopped doing the non-emergent procedures, is to provide capacity in case you do have that surge. So we have to be really careful how we monitor that. And so that's why we say we're going to ease into it, but because if we create a lot of, we fill up our hospitals with patients that are having surgery, and then we do have the surge, it's going to put us into a real predicament. So we have to be very careful in how we go about doing that. And we are doing that. So we're being really careful. If I can mention one other thing about nursing homes, we have been working with the Northeast Region Health Department and Sullivan County on modeling in the event we were to have a outbreak in a nursing home, how we would go about helping to evacuate that nursing home and utilizing the hospital to house those patients. And so I think we've done a really good job at working with the health departments here to put a plan together in case we do ever have to do that. And down in Gallatin, Tennessee, they had to evacuate a nursing home there, and it was really, really difficult. So Dr. Kursky said they're very susceptible, and so we we're planning to be ready for that if we ever have to do that. So I appreciate the cooperation and work with the health departments on that model as well.
Hey, Eric, we're having a conference call with the nursing homes on Friday, I think at 1:00. Are you aware of that, or is it possible you could be on that to talk about that?
Yes, sir. I sure could.
I'll make sure Tony Wright gives you the information.
Perfect. I'd be happy to be a part of that. Thank you.
Okay, well, these people have a situation under control today. Hopefully, this business reopening doesn't, create a lot of drama for them in the future. So maybe we can get past this. But there's been a lot of work going on with local business, trying to help them stay open and to do it safely. I know I've talked to a number of our industrial folks just before this call, got off the phone with Neil Poland at Mulligan, and they're looking at doing some interesting things about putting up shields in spaces where they can't create enough social distance. So when you work hard at trying to get your business going, there seems to be ways to do it. Brought in a couple of folks today that I thought you might be interested in hearing about how businesses are dealing with this and what they're thinking about in terms of reopening and what we're doing to try to help the struggling folks out there today. Maybe we'll start with Alicia. Alicia, could you just sort of maybe give us a quick update on, the industry sector and what you're hearing out there from them?
And thank you, Mayor. So I've been speaking with our manufacturing sector on a very regular basis. I've spoken to them about following the CDC guidelines and social distancing, and they've said that they are meeting or exceeding both of those guidelines. Couple of things to note, I think, is that there's a fair number of them that are experiencing supply chain delays, whether it's coming in air freight or truck. And they're attributing that to supplies going to grocery stores and that type of thing that's causing them some delays. Some of them are also having some issues getting some masks. They use, for example, some of them use silica in their process, and they have to use the N95 masks. So we've connected some manufacturers that need masks to manufacturers that have extra masks. So that's worked out pretty well. We also have a good number of manufacturers that have added some other items to their production lines, namely hand sanitizer, face shields, and Johnson City Bedding has added mattresses for field hospitals to their product line currently. We've sent out a lot of information about the SBA PPP program and the SBA EIDL program. A lot of our industries got in there early and have reported back to me that they have indeed started to see some cash flow out of those programs. If you're not familiar with the programs, the PPP is, and these are both loan programs. The PPP loan program is forgivable and can be used for payroll, rent, utilities, that type of things. The EIDL is for working capital. That one is not forgivable, but that's for loans up to $2 million for small businesses. We've also heard about some layoffs or furloughs. And remember that furloughs are basically a temporary layoff with companies planning on bringing those people back on. So we've heard about some of those, and that's pretty much across the board, a few here and there. Some have had larger layoff impacts than other ones. The automotive sector, medical or pharma related, seems to be hit a little bit harder from what I'm hearing this week. And those things seem to change week to week. We did have some very positive news happen, and you might have caught this earlier this week. So Crown Labs signed a contract with Purell to manufacture in mass quantities hand sanitizer. So they've got a 3-year contract. They're hiring 50 people to help them fill that contract, and they're looking to do that within the next 3 or 4 weeks. So that was really positive. Another positive thing that I'd like to mention is Borla Performance Industries, who typically does exhaust systems for fancy cars. They worked on a health policy that they spoke with Senator Rusty Crowe about, and Rusty took that to the governor's office, and they are looking at Borla's health policy to help implement in other manufacturers. So that was pretty positive too. And unless you have any questions, I think that's all I have to say tonight.
Questions for Alicia? I agree. Jim, I'm sorry.
No, go ahead, Mayor. If you've got one, I'll wait.
That's good.
I was curious. You mentioned the PPP program. I have been trying to check around sort of with businesses down in this area and have only found a few who were able to access those funds. And I'm concerned about a lot of our restaurants and hair salons and places that actually had to shut down. A lot of us were able to continue to get by fine. But for those small businesses, are you hearing much about them getting access to those PPP funds?
Mitch, do you have information on that?
I don't have a lot other than what I've heard from the banks or CPAs. I know I've been working on another project, which I'll mention here briefly, but Melissa Jones had mentioned about how Bank of Tennessee and First Bank and Trust and a few other local banks here that have really been knocking it out of the park. And I know, they've hit over $100 million in some of those cases with actual paperwork being submitted for the PPP program. But I haven't heard any direct success yet back from the small business on that. So, some of that stuff we've heard is starting to hit, and I can follow up with some of our contacts on the financial side that probably could give us some feedback.
What I'm hearing from the manufacturing sector is there's a lot of folks that have applied and been approved, but that doesn't necessarily mean that the funds are coming down. They may have run out of funds after they were approved, but I am hearing from several that they're actually seeing the money come in.
Yeah, several that I've talked to have the funds already, but I think, clearly it was, the first folks in, are getting the funds first. So it's a huge program direct from the federal government. And I think some of the other things, this unemployment is probably the worst one that I hear in talking to people about, is that, the system just got completely bogged down, and that's been frustrating. Although I do understand they're beginning to get those checks out. So it's not a matter of having funds. It's just a matter of, getting through the system. I know that the first part of last week, there were 2 days where the state processed over 100,000 applications a day. So, it's a huge issue out there. And Jim, your point, there's business people out there and people that have been laid off that are really really struggling right now, waiting for those first checks.
Yeah, and if I could add one other thing that might put that into a little better perspective related to unemployment. The week ending March 14, the state processed about 2,600 new unemployment claims, and 2 Fridays ago, they processed 96,000 new. So in less than a month, they went from 2,600 in a week across the state to over 96,000. Now, 2 weekends ago, the entire unemployment system online portal crashed. And they've been working on that on a regular basis, daily, trying to get that back up. They added some new enhancements to it, but they are still struggling with the number of claimants trying to get on there and certify and do some other things they need to do. What they've been doing for about the past 7 or 8 days is shutting down the system for about 4 or 5 hours a day to try to get it back up to speed where it needs to be for all the claims. So if you're talking to folks that are saying they can't get their claims processed, they are really working diligently to get the system. It's just overwhelmed with the number of people that are applying for it. And then adding to that, they've had to take that $600 bump from the CARES Act and kind of incorporate all of that into this system as well. But they are, I'm working with a group and helping them kind of work through the unemployment process. And I'm hearing from them that money is starting to flow again. There's still folks that have been waiting 3 and 4 weeks now for their first check, but there's some too that apply less than a week ago and are already getting their first checks in. So it's coming along.
Yeah, the system's tough. What used to be unemployment agency facilities are now American Job Centers, and the local or the Northeastern Tennessee director, Kathy Pierce, I spoke with her this afternoon, and they shut their doors just when people probably needed some walk-up help to went to a totally online system. So it's challenging, and she's concerned about reopening them because there are a lot of people out there that are very frustrated. But that is improving some. Alicia, to your point, in talking with Neil Poland from Mulligan just a little while ago, there are these industry groups that are coming together to work on procedures to create social distancing and do other things. This Borla report, I think, is a great example of shared information with these folks, and they're actually screening people, their employees as they come in. They've reduced the number. Well, they've eliminated visitation and create a lot of processes that allow their facilities to operate. And I mean, their goal obviously is to keep their people safe so they can stay on the production line. But Neil had said so far they hadn't had a case in their plant, and prior to that they had over 5% of their workforce out either with stomach virus or flu. So maybe we're learning some stuff. Alicia, thank you. Mitch, you've been working with a little bit local small business and some other things. There's been a lot of work going on with the local chamber of commerces coming together all across the region, not just in Sullivan and Washington County. There are two economic development organizations, NetRep and Networks, have come together to work collaboratively. The regional tourist group, all focused on trying to help small business and businesses stay open or reopen. So, Mitch, you've worked on an interesting project. You'd like to share that real quickly with us?
Sure. Thank you, Mayor. I'm going to go ahead and apologize. I've got a dog next to me that's in apparent need of attention right now, so she's got a squeaky ball. If you hear it, I apologize. Susan, I don't know if I've got the ability to share screen. I think I do, but I figured it'd be easier just to walk you through some of the things we've been working on. Let me know if y'all are able to see that.
Yep.
So roughly about 4 weeks ago, a little over 4 weeks ago, as all this was kind of, there goes the squeaky ball. As all this was kind of coming together with COVID and trying to understand the impact, basically jumped on the phone call with Miles Burdine, who's the Kingsport Chamber executive there, Bob Cantler in Johnson City, Beth Reinhart in Bristol, and my counterpart over in Sullivan County, Clay Walker, and then Alicia Phelps with NETA. And we brainstormed some ideas and things that we could jump on quickly collectively together. And we created a website, which is an economic aid directory. And with that, we just really wanted to give the opportunity and ability of businesses across the region to go in, list their business, and you could search that by county. As you see, I'm going to pull up Washington County, Tennessee. and really to show us how we can best help, to have kind of this resource center. So instead of sifting through Facebook posts or, just hearing word of mouth or other things like that, just trying to give the ability for each of the businesses across the region to put in, one, are they operating, are they essential, how they're actually, conducting their business hours, if they're doing curbside as a restaurant, but also to just what it is that we could do to actually help them out. Like I know, for instance, Fanatics, which you see here, they really would like people to purchase gift cards. So they put in a link there where you could actually go in and do that. Just trying to provide a one-stop shop and a resource. As that started to evolve, and I think we're sitting about 350 businesses across the region have put their information on here, we realized the need was going to be much greater than just a directory. And so we wound up partnering up with a couple of different private sector groups who had some thoughts and ideas. One in particular was Andy Dietrich with Champion Chevrolet. And Andy had kind of the vision to do something similar as to what you've seen with the Children's Hospital Radiothon. And Andy really pushed us and challenged us to come up with, a creative way to engage more people across the region, to get into, the rural communities in Unicoi County and Hancock and all the way up into Southwest Virginia, up to Marion or in Tazewell County, and really try to get everybody together, get on board, have a bigger reach, and do a fundraiser and create a fund that is going to help our small businesses. And, with money being scarce and hard to come by, PPPC being so competitive, to at least start embracing the idea of what we could do to actually save some of our local businesses. So we took the directory a step further, and we created this local business recovery fund. And that actually launched on Friday of last week. And there's ways for businesses to go in and actually apply for the funds. And I'll pull that side of it up. You can see basically this is the territory that would be made available. If you are a business, you are able to apply. And you've got 8 counties here in Northeast Tennessee, which is the 1st Tennessee Development District. And then you have the Lennowisco District that's up in Southwest Virginia that we incorporated as well. You can see each of those counties outlined here. This specifically is looking at the arts, entertainment, recreation, accommodation, food service, retail trade, and manufacturing sectors. And you have to have 50 employees or less. We came to that conclusion on those sectors because ultimately, looking at some analytics and data that an economic development agency that we've times and then provides us with data, really looked at, these are going to be the key sectors that are going to get hit the most and hurt the most during this time. And so that's how we came to that conclusion. And then the 50 job piece is, we were really looking at, if we were to raise $1 million in this and try to help as many people as we can, you may only be looking at $5,000 to $10,000 per grant. And for a mom and pop shop of about 7 people, that's going to mean a lot more than a large scale manufacturer that has 1,000 people. And so just trying to make sure that we could at least reach and have an impact, a greater impact. That was kind of the desire and intent on that end. And then also too, just outlining that this would not be made for capital funding projects, constructions of buildings, remodeling projects, purchases of vehicles, that it was actually going in to keep this business alive and well. And we've established an allocations committee. We've kept the members on that committee's names private. So I figured some of you may have a question about that. The intent of that is that, we can't afford to have those individuals being called by each local business here within the community and the region, begging and pleading. We're going to just do our best to take in these applications and ultimately provide that information to them. But it's a very simple process. It's all web-based online where you can actually go in, you have a checklist of what we're asking for, and to make sure that you have that as you submit. You can see the eligibility side again. You can download a PDF and save that if you want to, or you can actually go in and do that formally here by putting in your name, mailing address, and really looking at all the questions. And the intent of this too is to not only collect that data, but if there are opportunities, like I look at a veteran-owned opportunity or a woman-owned or minority-owned opportunity, that we may be able to push some of those businesses here to other outlets and other forms of dollars. And so some of this is data collection on our end, so we can find more resources just beyond us providing a check for support. And through that, I won't go through all the details, but you can see there's some really good questions. And one of the things we're also trying to find out, which I think would be really impactful, is what innovative ideas are you planning to implement into your business due to the effects of and the impact of COVID-19? There have been a lot of businesses that have been really creative. It's kind of thrown into the fire to figure it out, and a lot of them have. And so as we can collect some of that information too, it might be something worthwhile that we can share across the board with businesses in the region to be more effective and have some guidelines in place and procedures in place to be more effective in how they conduct business during this time. So that's the application side. The donate side is a little bit more simple. Instead of asking all these questions, the only thing we're really asking of individuals is to give us your email, your full name, and your credit card number. So, if that's something, we've been pushing this pretty much across the region. Everything from our media partners at WJHL to WCYB, the press, News and Neighbor, so many have just been amazing to give us free airtime, free ad space. I can't speak to just how appreciative I've been and our group's been of all those that have stepped up and offered their services at no cost. Big props goes out to Tony Treadway with Creative Energy, Chris Bowen with Cumberland Marketing, Ashley Shutt with Aero Creative. Everything that they're doing for free. They love this region. They love the community and the people and the businesses that are part of it. So, a lot of people are doing this from the heart and just doing what we can. To date, the update that I got this morning, and I'm sure it's a little more by now because that was at about 11 o'clock this morning. I think we're standing since the launch on Friday at about $80,000 collected so far. So it's been pretty impactful to see that come together so quickly. From the net rep side, we had a committee meeting last week, and I was very appreciative of our board stepping up. Our board contributed $5,000 to the fund as well to help businesses here in the area. But I've got to take the opportunity because, again, Andy Dietrich has kind of been our champion with this, and he's a car salesman, so he's really trained us well and pushed us to ask for money. So if any of you all are in a position and are willing to do that, we would welcome any donation that you could give individually. And it would go a long way to really help and support a lot of the businesses that make this place special. So, I thank you for that opportunity, Joe, to talk about it. And if it's okay, I'd like to show kind of a video of one of the ads that we're running. It kind of gives you an idea and perspective of the story we're trying to tell. So I'll pull that up. And this is one that's actually, you're getting a sneak peek at something that hasn't actually been released yet. So if there is media on the call, please don't air this if that's okay. So that kind of gives you a flair. We've done some other things with businesses and actually done kind of 30-second pieces as well. Matt Moses at USA Raft, the coffee company over in Elizabethton, Stir Fry over in Kingsport. We've got a couple lined up with Southwest Virginia. And then we've also had individuals do PSAs like President Nolan, Scott Niswanger, Steve Smith with Food City, Coach Steve Forbes. And we're going to start trying to incorporate a lot of those. There's several others that I didn't mention, but a lot of people are behind this effort. And I guess as Joe kind of talked about, it's been pretty amazing to see the region come together and kind of band together to try to help each other out. Because right now, I mean, we need everybody to step up.
All right, thanks, Mitch. Questions for Mitch or anybody else?
I just have one question, Mayor, for is Eric still on with us?
Yep.
Yes. Eric, you talked about the antibody testing. I know that is something that, is that just being done there at the medical center now?
We have not started it actually. We can make it available. And just one thing, we just found out this week that we can get the tests from Abbott, and we found out today we can get them from Beckman Labs. So we've started asking a few businesses, just if people be interested in this. I think I want to be careful. I would ask what people want to, how they use it, and what because it can give a false sense of security, I would think. So we want to make sure that our physicians, and I've asked Dr. Kursky also to make sure that people understand what it is and what it isn't, because we don't want people to think if you have the antibody that you cannot get it again, because we don't know that yet. But it is something that may be a tool for businesses to use at some point in the future. And I know it's been talked about a lot on the media, on the news, and so we do want to make it available if someone sees benefit there.
Thank you so much. I do want to thank you also. Ballot has provided the daily update in an email, and I really appreciate those. I know several of the commissioners do, and we want to thank you for doing that. And please pass that along for us. I know sometimes we all send out emails and wonder if everybody ever reads them, but I think this group is, I know I read mine every day, and I want to thank you for that.
I'll pass that along to our communications folks. They work hard at it. I appreciate the feedback.
That's all I have, Mayor.
That's all I have, Mr. Chairman.
Thank you, Mayor.
Greg, I have a question.
Oh, I'm sorry, Commissioner Jones.
Chairman Matherly. Mitch, is this, it's wonderful, and thank you for doing it, and to all the people who participated. It looks fantastic and has a lot of potential. Is it, I had heard early on that you all were actually reaching out and calling businesses as well. Does this replace that, or is it complementary to that?
No, I would say that this could be complementary to it, but in a different way. So we have worked with Joe in Washington County, and then Pete Peterson with the City of Johnson City on a business ambassadors program. That's probably what you're referring to, where kind of developed a script. Alicia did a phenomenal job, coordinating and kind of organizing a lot of it. But we've actually been reaching out to businesses in Washington County, asking specifically, their current status. Are you opened? Are you deemed essential, non-essential? Also trying to make sure if they are essential that they've got proper guidelines in place.
Right.
They've got questions that we just want them to know that, one, we care about them, that we're a resource for them, and that we're pushing them to the Region Ahead site. And we work specifically with Keisha Town at Johnson City to help kind of build out a structure that kind of goes along with their script to say if they have questions about the CDC, we've got a button that pushes them right to the CDC website or the Department of Health, or if they have unemployment questions to the Department of Labor, whatever it may be, that we've got very quick access links. And when you go to the site, it says, I need information about, and there's boxes that are very, short line specific to get them to where they need to get to. So that's been a really great program too. And then on top of that, I know when the Safer at Home order was issued, we put our number out there as kind of a contact in that press release. And we've got some referrals, I know, from the Department of Health and others, I think have mentioned our number and name. And so internally as a staff, we've had the calls forwarded to our cell phones. So today was my day and I had all kinds of phone calls to answer. But it's people who either live in the community or calling in saying, hey, I was at this business and I'm a little concerned that they didn't have proper guidelines in place. I'm not trying to get them in trouble, but could you guys reach out to them and make sure that they've got, this, and this? Or it could be businesses actually calling us directly and saying, hey, I need assistance with TPP. Can you help me? Just doing everything we can to kind of be a one-stop shop and do what we can to help them and help the citizens here in the community as well.
I mean, as far as I know, you're the most centralized place, and I think some of the mayor's work with the regional recovery group also for kind of navigating the dimmer switch, which is a great metaphor. I mean, if we're trying to figure out how much to open and how to open, there are not a lot of great guidelines. And it's really going to take that dynamic, like back and forth conversation between businesses and health officials, but we don't have a process for that. And it seems like you really have your finger on the pulse of what businesses are grappling with. I just had one conversation with my hairdresser today, and it just like my mind was blown by all of the pressures that she's under, from consumers who want haircuts to concerns about not opening, and then do her customers go somewhere else and you lose business, to employees that are one paycheck away from disaster and want to get back to cutting, to not really wanting to bring people in because it just seems very unsafe. And it's really running the gamut of concerns. And so that's just one example of one type of business. And you're really talking to the whole gamut. And I don't have a whole huge point to make here, except that if we don't figure out a process for creating a good line of communication between businesses making decisions and how they can get guidance, and then also health officials being able to say, well, here's a practice I would recommend, or here's some things we would suggest, and then innovations being communicated across all sectors. If we don't get that scaled up real quick, well, it's just like everything else. But thank you for your work, and anything I can do, let me know. I appreciate it.
Yeah, no problem. And Jody, I'll do one last screen share, and I'll be quiet. You know, when we created this site, the idea was to make it as simple as possible. And I know I've talked to Alicia a little bit about it, and I talked to my counterpart over in Sullivan County, Clay Walker, about it today. You know, it's easy for us to change this around. So if there is information as that dimmer switch, you know, gets turned back on a little bit, you can plug and play, have kind of a resource center tied in for that. And this has just been helpful for us as we've had those conversations with people to just get them to a one-stop shop. And, you know, I hate to say it this way, not everybody reads their emails like Chairman Matherly does. So when you get an email and you got a ton of links and a ton of words, people zone out and they just move on. So we're just trying to just do it as simple as possible so people can find the right info.
Mr. Chairman, I might add that we do have Rusty Sells with us today, our EMA director, and in the event anyone has any questions of him, he's patiently waited.
Wait, Joe, I'll say this: if you all are okay, I've got to go pick my son up, and if you're all right, if I can pop off, I appreciate just the opportunity to share information tonight.
Thanks for your time. Feed that dog.
All right, see ya.
Joe, I want to sign off too. Thank you.
Thanks, Eric.
Appreciate everybody.
All right, Mr. Chairman, it sounds like no one has any questions, and that's all that I had for this evening.
Well, Rusty got off easy tonight, Rusty, you know.
But
he don't get off easy all day, so at least we get him off easy here tonight. But Rusty, we want to thank you for all you do. I see your work every day. I guess that'll conclude our agenda. Does any commissioner have any questions or comments before we sign off? Seeing none, is there anything I need to cover, Allison? I guess our April 27th meeting at 6 o'clock, that'll be Monday at 6. And if you have any agenda issues or anything, please let us know. And we'll get you an agenda if so need be. I don't think we're printing any of those, right, Mayor?
Just a few.
Just a few, unless you
specifically request. Yep, someone needs a copy, we'll make it available.
All right. Looks like we're all in. We have a motion to adjourn.
Move to adjourn.
Motion made by Commissioner McAllister. Is that a second, Commissioner Jones? Thank you.
Yep.
Madam Clerk, if you'll call the roll to adjourn, please.
Light.
Yes.
Harris. Fitzgerald.
Yes.
Edens.
Yes.
Davenport. Matherly.
Yes.
England. Malone. England was a yes. Malone.
Also a yes.
Williams.
Here. Yes.
Carriger.
Yes.
Jones.
Yes.
Chester.
Yes.
Callis.
Yes.
Wheeler.
Yes.
Ford.
Here. Yeah.
13 yes, and I have 2 absent.
13 yes, the motion passes to adjourn. Thank you all so much, and we'll see you Monday.
See you Monday.
Thank you.
See you Monday.